Hello, my name is Ann Liu. I'm a Senior Technical Advisor with the Clinton Health Access Initiative, or CHI. I am joined by my colleagues from Health GeoLab, Terraframe, and from CHI to present Sharing the Same Geography, Use of a Common Geo-Registry as a Central Authority for Geospatial Information Core to Sustainable Development. So starting first with sustainable development. As we know, SDG 3 ensures healthy lives and promotes well-being of all. Two key variables in order to achieve this goal are geography and time. These are two variables intrinsically linked to public health. They allow for one to assess and monitor the health of communities and populations at risk. They're important to assure that all populations have access to quality, timely, and cost-effective care. And ultimately, they're important for formulating public health policies. After all, everything happens somewhere at a given time. As an example, most public health goals in a country are linked somehow to a geographic component. For example, within an EPI program, there might be a goal to achieve universal coverage of a routine vaccination. In order to achieve that goal, they might need to know what is the village, what is the unit that we are looking to achieve universal coverage within. A national malaria program might have the goal of 90% of the population having access to vector control interventions. A maternal child health program might want to ensure all coverage in need of care receive proper health care. And a Department of Planning and Cooperation might want to ensure every village has one village health worker. All of these goals have something common between them, coverage. And in order to understand if we've achieved coverage, we need to understand the geographic component. Where do we need coverage and how do we measure progress against it? However, it's easier said than done. After all, geography changes over time, and information systems might not necessarily be built to be able to capture those changes. And what you end up having is different information systems managed by different programs or different sectors storing data on the same geographic object in different ways. A geographic object being, for example, a health facility, or a district, or a village, or an administrative boundary. As an example, within the Ministry of Health, one health center might be spelled just a little bit differently between an HMIS unit and a Department of Planning and a malaria program, and might certainly have a completely different ID. This might be exacerbated between sectors when you also have districts or villages facing the same problem, where they're spelled a little bit differently between different sectors and certainly might have different IDs. For all intents and purposes, when you look in the information system, they might as well be completely different health centers or completely different districts. Additionally, countries might organize their territory in different ways. A country might have a completely different administrative district hierarchy compared to a health operational district in the hierarchy it sits in. That can also exacerbate issues in an information system. Ultimately, we then end up with the problem of information systems maintaining different geographies. You might have different databases managed by different programs, all having their own version of the same map. Attempting to link this between systems can be extremely time-consuming and lead to errors or loss of data. Also, having different systems on the same location or the same objects can lead to uncertainties on the number of objects in a particular area. This can be extremely problematic, especially during a public health event. For example, during an emergency, you don't want to be asking what's the latest on the number of health facilities, who has the most up-to-date data set, where are the villages, what's the latest boundary. These are all challenges that can be exacerbated in a system where information systems manage different geographies. Trying to maintain updates of this data can be very challenging without a strict SOP and change management process. And finally, the creation and maintenance of several data sets that often happens results in duplication of effort and less effective use of available resources. There might be many instances where different programs within the same sector might all build into their budget, might all build into their work plan, and attempt to collect data to update their data on health facilities, for example, instead of sharing the same information. The takeaway here is that different stakeholders might end up maintaining and using different geographies, despite the fact that we all share the same geography. This presentation presents a solution called a Common Geo-Registry. The first part of this solution is masterless. A masterless is a unique, authoritative, officially curated by a mandated agency, complete, up-to-date, and uniquely coded list of all active and past active records for a given geographic object. Geographic object, for example, being a health facility, administrative division, or village, as we mentioned before. The second part is a container for these lists, a registry. This is a central authority that can collect, store, and distribute an up-to-date and standardized master list or multiple lists, and as a platform that is set up in a way with features and functionality that allows for sharing this data in order to maintain that that data can be indeed a source of truth across programs. These two things come together to form a common geo-registry, a technology solution that allows the simultaneous hosting, management, regular update, and sharing of master lists, as well as their associated hierarchies and geospatial data. This CGR then allows us to pass from the issue we see on the left, where once again we have different information systems managing different geographies, to something on the right, where you still have different information systems and different databases. And let's be clear, the CGR is not designed to replace existing information systems, but any of these information systems can still leverage one registry for their geographic information. All that allowing us to take advantage of the power of using one geography. This project to achieve this vision covers three components. The first part is to build the technical platform that can achieve this vision. Our colleague Nathan will speak more on this and demonstrate this later on in the presentation. The second part is to actually generate the content that can serve as a source of truth. This is to generate the master lists and their associated hierarchies and geospatial data, working across programs to determine what is the most up-to-date and trusted source of health facilities, villages, administrative boundaries, etc. And the final piece is to enable an environment, including the governance, SOPs, policies, capacity, both for technical as well as for data management, to ensure long-term sustainability. We will have three presenters for the remainder of this panel. We have Steve Ebner, the founder of Health GeoLab and original visionary behind the CGR vision, who will talk about what the CGR is designed to achieve and what features will help it get there. We will then have Nathan McEachin, the CEO of TerraFrame, which is building the CGR platform, and he will speak about the technology that allows us to achieve this vision, and we'll demonstrate it as well. And finally, we will have Pedro Olivares, the technical advisor for CHI in the Greater Mekong subregion, who will speak about the implementation experience thus far. All right, over to you, Steve. Thank you so much.
Thank you, Anne, for this introduction. We will now talk about the elements being addressed by a common geo-registry. The CGR is first about content. The CGR handles three types of data in order to manage geography through time. We have lists, hierarchies, and geospatial data. The concept of list was defined earlier by Anne, and I will just therefore mention that these lists focus on specific type information. The information in question allows to uniquely identify each geographic object, not only through the use of a unique identifier, but also the name attached to the object, or even sometimes a picture. To classify the objects based on specific characteristics, such as type or ownership. To locate each of the objects. Depending on the object, this could be through the use of an address, its location within the administrative structure of a country, or geographic coordinates. And finally, when it applies, especially in the case of infrastructures, to contact each of the objects. The first important point to emphasize here is that the CGR focuses on the geographic objects. As such, it does not include any programmatic attributes, like for example, malaria prevalence or population. Such programmatic attributes are meant to be handled by other information systems managed by the entity in charge of this information, and ideally plugged to the CGR for synchronization. The second important point is that all this information, except the unique identifier, which should ideally remain the same, can change through time. Such changes are therefore being captured in the CGR. Hierarchies are themselves capturing how geographic objects are linked together according to different types of relationships. For example, these relationships can be geographic, administrative, or based on certain services, like the referral in the case of health, for example. In other words, a given set of geographic objects can be organized in different ways and connected in different ways, leading to different hierarchies, and these hierarchies can change through time. You have an example here of 6 different hierarchies used by the health sector in Cambodia. Geospatial data does itself refer to the location and shape of the geographic object. In this context, the CGR handles objects that are represented by points, by lines, or by polygons. And the geography of an object can, of course, change through time, which is also something being captured in the CGR. At the same time, the CGR does not only manage multiple languages and therefore characters, but also different spellings for the same geographic object. As such, the CGR can not only display information in different languages, but also serve as key correspondence table between different information systems that will be using different spelling for a same geographic object. The CGR handles official and non-official data in parallel. This is, for example, very useful when there is some delay with the updating of the official information, like a list, village, in the case presented on this slide. While a given program, the malaria control program, for example, need for the list to be complete in order to implement a specific intervention. So by allowing to manage both type of data, the CGR allows the malaria control program to implement its intervention while waiting for the official information to be integrated in the official list in the CGR. The CGR is also about processes. Among these processes, the first one is the possibility to bring different unofficial lists into a common master list that will serve as the source of truth. This can be done within a given sector, like it is presented here for the Ministry of Health, where different units will be using different lists and coding systems for health facilities, or across multiple sectors for geographic objects in common to all of them. Administrative divisions or villages are a good example in this case, where the authoritative entity having the curation mandate over these geographic objects, the Ministry of Interior in the case presented here, could work at making sure that the different lists used by different ministries converge to using the same spelling and coding system. The CGR then manages and stores changes over time. And this not only to keep track of changes in geometry or geography for a given object, like it is presented here, but also changes in the attributes attached to each of these objects. This capacity supports the operationalization of the updating mechanism associated to each type of geographic object. As such, specific users can submit requests for changes, which are then validated before being integrated in the database. These changes become then accessible to the information systems and individuals having access to the CGR, including those that have provided the change request in the first place. The connection of other information systems to the CGR through API is what ensures data interoperability between them, and this from both a geographic and temporal perspective. Such an interoperability allows for specific analysis to take place, either within a given system or across them. Last but not least, the CGR supports data governance not only at the organization or sector level, but also across sectors. As such, the CGR can be used to support the implementation of the National Spatial Data Infrastructure, NSDI, or the Integrated Geographic Information Framework, IGIF, as promoted by the United Nations Committee of Experts on Global Geospatial Information Management. All of these contributes to the SDGs by enabling the effective use of geography and time for data visualization and analysis. First, the CGR allows different information systems to properly contextualize any piece of information in space and time. This is a key entry point to any spatiotemporal analysis, especially when using different sources of data. This is also central to many interventions like communicable disease surveillance, for example. Once a piece of data or information properly contextualized in both space and time across information systems, geographic object can be used as the common link between data sources. This allows to obtain a comprehensive picture of the situation for a given place, a district, for example, at a given point in time across all sources of information. Doing so supports decision-making. The CGR does then provide information on how geography has evolved through time. This information is needed when performing trend analysis, especially in countries where administrative divisions are changing regularly. By capturing the relationship between geographic objects and how these relationships evolve through time, the CGR provides the possibility for information systems to aggregate data and information according to different hierarchies. This is, for example, important in countries where the health sector is taking decisions based on a different organization of the territory than other sectors. Last but not least, by managing and sharing the geospatial data associated to the different geographic objects it contains, the CGR does not only support the creation of maps based on the correct geography for a given point in time, but does also ensure consistency between these maps. In conclusion, the CGR does not only contribute to the implementation of the SDGs, but also to the integration of geospatial data with statistics. Time to have a look at the CGR platform through a demo. Over to you, Nate.
Thank you, Steve. My name is Nathan McEachin, and I am the software architect for the CGR. Before I jump into the demo, I thought it would be useful to describe how the CGR was architected. So the CGR was built using open source components, and it leverages an open source library, a software development toolkit called GeoPrism that has a spatial knowledge graph implementation. So what makes integrating data across disparate systems so difficult? Well, among many problems is you deal between different systems with incompatible data formats. Your data structures or your schemas are different, and most importantly, the data semantics are different. Well, what does that mean? Well, it means that across different systems, different terms are often used to represent the same or similar concepts. So just normalizing all those different terms can be quite difficult. So spatial knowledge graphs can help automate the integration of disparate data across these multiple silos by common geographies, the geography component that Steve had mentioned. So let's go a little deeper and discuss a real-world example, an abstraction of a real-world example, I should say. So often different projects are developed in complete silos, and across different systems, location data are represented much differently. So here in this sample example, we have an entomology data set for assays on mosquitoes. We have an indoor residual spraying data set, and we have some geographic data from an authoritative source, such as the Ministry of Interior. Now notice here, even at the metadata level, how they're represented, right? The entomology data set specifically references provinces, districts, sentinel sites, and so forth. And the values they use are labels. But these labels may not necessarily be consistent, especially when you involve different languages. In the IRS data set, it doesn't necessarily tell you, or at least the metadata of the data doesn't necessarily tell you what these different location types are. It just records these as level 1, level 2, level 3, which in this example also happens to be province and district. And the IRS data set uses an internal ID, an ID that's only used within a siloed system. This is an application for enabling IRS. So these are internal software IDs. And another common representation of data are postal codes, right? So metadata for how location is represented and instance data are different across multiple different systems. So how do we enable these data sets to be brought together by their common geographies, right? So the CGR leverages spatial knowledge graphs that are built off of ontologies. What is an ontology? Well, ontology is a data model that defines domain concepts and their semantic properties, including classes, attributes, taxonomies, and how different classes relate to each other. So here we have an example, a non-spatial example of an entomology adult diagnostic assay, where an ontology defines attributes. It also defines taxonomies. Now, a geo-ontology is the same principle that is used to describe location information and types of location information and how they relate to each other. So a geo-ontology is a meta-model. A meta-model is a way for defining data models. So it's a meta-model for defining classes of location types, their attributes, and their semantic relationships between each other. So the CGR has a geo-ontology meta-model that allows you to define location types. You can group them together. So for example, you can say that there is something called a health facility, and different kinds of health facilities would be national hospitals, provincial hospitals, referral hospitals, and so forth. And that these other types of hospitals are also health facilities, so they can be grouped together. But by defining them separately, what you can do is you can also, for these different types of hospitals, in the geo-ontology, define how they relate to each other. So on the diagram here on the right, we have, on the left-hand column, an example of a Ministry of Health reporting hierarchy, where a health center reports to a referral hospital, which reports to a provincial hospital, etc. But these location types relate to other location types, or geo-object types, as we call them in the CGR, managed by other organizations. So a provincial hospital is located within a province, which is curated, mandated by the Ministry of Home Affairs. So here we have explicitly modeled in the geo-ontology that a provincial hospital reports to a national hospital and is located within a province. So right, these are the constraints. This describes how these different location types relate to each other. So now a spatial knowledge graph is instance data, individual locations, individual geographies, and how they relate to each other according to the model defined in the geo-ontology. So what the CGR does is it can ingest data from multiple different sources, and it builds this knowledge graph of these locations. And so we're using a graph database in order to implement this. Relational databases don't really handle this very well. They don't model hierarchies natively. So a graph database really is the best approach here. And so as you can see, these relationships get incredibly complicated. So in this example, you see that villages A, B, and C all reside within the same commune, but villages B and C are in a different operational district compared to village A. So you can imagine how difficult it is to, as these spatial relationships change in one silo, to propagate that information to other silos as well. So as the Ministry of Home Affairs changes these administrative boundaries, how do you ensure that other systems that utilize those hierarchies are also updated, right? So what the spatial knowledge graph does in the CGR is, what it does is we have a number of algorithms that we have developed that helps to normalize these different representations of location. So it has a number of matching algorithms that can match the way location is represented differently in various systems, right? Now the CGR does not ingest data that is specific to a domain. So for example, the CGR does not ingest entomology data, does not ingest IRS data. But what it does do is it has the means to, facilitates the means to normalize the location information in these different systems to create a single source of truth, a single reference that knows how, that models how these locations are represented in different systems, okay? And so this is an example of what the CGR enables. So by matching the way location is represented in these different systems, now these different systems don't have the burden of having to maintain this geographical data for which they do not have the mandate, right? So now location can be represented in common across multiple systems, and now you can bring these data sets together. So in this malaria example, it's very important for a spray team to know that if the insecticide that they're spraying contains an active substance, that the entomologists for this particular village have already determined that the local predominant mosquito species is already developing a resistance to. It's very important to know, but that's a very difficult question to answer today. It's very label intensive to bring these different data types together versus the CGR can really automate this process. So I'm going to jump into the demo here. So the demo uses fictitious data for a country that we call the Tolkien region, with the boundary types inspired from the Tolkien books. And let's jump into that right now. And welcome to the CGR. The CGR was designed with a multi-tenant architecture, so there are a number of user roles and responsibilities that allow different organizations to manage their own geographic data for which they have the authoritative mandate. So I'm going to log in as a super registry administrator who has the responsibility of defining organizations within the CGR, can do some account management, can define new locales. Localization is pretty straightforward. It involves importing and exporting spreadsheets and assigning people to become administrators for particular organizations. Now, let's talk about some of these user roles. We don't have a lot of time, so I'm gonna have to go through this here real quick. There's a lot to show. So one important role is the registry contributor role, or RC. So here in our demo instance, we have a user name called MOA RC, Ministry of Home Affairs. Now, people in the RC role can view geographic data, but they also have the ability to make suggestions. So if they see something in the CGR for a particular location of the type for which they have the permission to make suggestions, they can post that suggestion, and then those suggestions can be approved by people in the registry maintainer role. Let's look at one of those real quick. So people in the registry maintainer roles have the ability to edit data and also approve suggestions that are made by registry contributors. I'm having to oversimplify in the interest of time, but I hope you get the general idea. Now then, we also have the registry administrator role. People in the registry administrator role for a given organization have all the permissions I mentioned earlier, but they also have the unique privilege of being able to define geo-object types and to define hierarchies of types and how they relate to each other, and I will show you that next. I am now going to log in as a registry administrator for the Ministry of Health. And I'm going to define a new hierarchy. Now I'm going to jump into the Geo-Objects and Hierarchies module. Now, truth be told, I'm actually on a different instance of the CGR. I'm not on the demo instance because we have some preview functionality here that we've just developed that's undergoing testing that we're really excited about, and I thought it was worthwhile to show in this demo. This is the new upcoming hierarchy manager and not the current one. This one is much better. It's a lot more features. Okay, so what are we looking at here? We are looking at different geo-object types that have been defined in the system and also different hierarchies that have been defined in the system, grouped by the organizations that have the authoritative mandate. Okay, and you can see we have some test data over here. But I want to highlight right here the definition of these geo-object types. So here we have the definition of health center. You can define new attributes on health center. So you can define text attributes, inner attributes, decimals, booleans, dates, and terms. Terms are a list of selectable attributes. Unfortunately, we really don't have time to dive deep into this here. But what I want to highlight, though, is that you can define these new geo-object types. And when you do that, what the CGR is actually doing, it's creating tables within it's creating classes within the spatial graph database. And then when you add attributes to these different types, it is also adding these attributes to the database. It's automating sort of the CRUD, the create, read, update, delete life cycle of instance data for these different types. And so let's look at some hierarchies here. Let's look at some Ministry of Home Affairs hierarchy. Here is we have a definition. Now I'm logged in as Ministry of Health, but here we have a MOA hierarchy. Now these are the Tolkien regions, the fictitious Tolkien regions here, where villages are located within shires, shires are located within counties. Now, as MOA, here we can see that we're now viewing the health referral hierarchy. So this is similar to what we had depicted in a previous slide. So here we've, the hierarchy type is for modeling how different locations report to other types of locations from a healthcare context. So a health post reports to a health center reports to referral hospital, etc. Now, what I want to do is define a hierarchy, and it's going to be the health geographic hierarchy. How are these different types of health facilities, how are they geographically related within other boundaries? So we're going to find this new hierarchy by going back to geo-object types, and I'm going to include, let's say health center. So health center is now in my hierarchy. And one thing I want to do is I want to include the Shire. Now the Shire here is managed by the Ministry of Home Affairs, but I'll just go ahead and drag that here. So what this means is that I, as someone who works for the Ministry of Health, am specifying that health centers are geographically located within shires. I don't control shires. Shires are controlled by MOA. Now let me go ahead and add some additional health facility types. So national hospitals are, in our fictitious example, located within shires. We have health posts, and we have referral hospitals. Okay, great. Now, my hierarchy isn't quite complete. What I'd like to do is whenever I am viewing lists of health facilities, I don't just want to see the parent shire that these health facilities relate to or reside in. I want to see the entire administrative hierarchy of the shire as managed by MOA. So if I click on this link here, I have the option to see other hierarchies that this type shire participates in. And here we see the administrative hierarchy for MOA. And now what I want to do is I want to be able to tell the CGR, okay, when I'm looking at my health geographic hierarchy, I want to include all of the parents and grandparents of the shire. So I'm going to click this inheritance button right here. Okay, now what did that do? What I've just told the CGR is that I, as the Ministry of Health, am responsible for the relationships between health center and shire. But whenever I generate lists, I want to inherit the relationships managed by MOA. So what that means is at a certain point in time, if a province, a particular province is split in two, and MOA reassigns the child counties accordingly, then when I generate my health facility list, I automatically get that update. So it's a common problem with these lists is although the Ministry of Health may be doing a great job at maintaining their own list of health centers, the administrative boundaries that they're including in their list may actually be out of date. And it may take a while for that information to propagate to them. Whereas here, what we're going for is we're trying to automate this. So as MOA maintains and curates their hierarchy, that any dependency that other hierarchies have with the MOA hierarchy are automatically updated. And it does that for different periods of time. Okay, we are back on the demo instance, which is the current official released version. The hierarchy manager will be a part of this version here real soon. So we don't have much time, so I will give a brief overview of some of the remaining modules. And here we have the import module where for your organization, I'm logged in as the registry maintainer, or I'm sorry, the registry administrator for Ministry of Health. I can specify the data type that I want to import. Currently we support spreadsheets and shapefiles, and I can also specify the time period for which this data are valid. So you can import historical data, and that will update the spatial knowledge graph with the correct time component. And if the data set is quite large, it can take a little while to import just because the CGR performs a number of integrity constraint checks. And this is done asynchronously. So you can close your browser, walk away, come back, log back in, check the status of your upload. And if any problems occurred, you have the ability to view the problems and modify the data in order to get the data to pass the validation check. Now let's look at lists. This is what it's really all about. So once the data has been imported and your hierarchies have been built, your spatial knowledge graph for the correct time periods have been created, and then you can publish a list for the different types. So here we're looking at a list definition for health centers. Now we have two different kinds of types. We have lists, we have exploratory and published. So you can specify a time frequency to generate a list. So you can specify whether you want to have a list generated on an annual basis or a quarterly basis. And then it will, basically what it does is it traverses the knowledge graph and generates a flattened two-dimensional data structure showing what these relationships with the list look like for that period of time. You can also, oops, went back a little too far there. You can do an exploratory list, which is you can specify any arbitrary date and say, show me what the list look like for this particular date. So let's go ahead and look at this one that was generated for the period this year. in February. Okay, so now we're looking at a list of health centers, and I'm going to modify an object for a particular period of time. So when you're modifying an object, you can change its attributes, you can change its geometry, and you can change its relationship to its parents. And for all these things, you can do it for different periods of time. Now, what we're looking at here is the parent referral hospital, and this is valid for January 1st, 2000 through today, basically, for the future. And I want to say, well, no, that's a value that was true in the past, but it's not true today. So let me go ahead and specify a new referral hospital. I need to specify the date. And this change occurred 10 years ago. All right, let's specify a different referral hospital. So 10 years ago, its referral hospital changed. Let's go ahead and make that change. Now, you'll notice right here, the value in this list changed. Now, let me go back. So it changed to San Juan. Let me go back to sorry, it looks like in full screen mode for the video that lost my my back arrow buttons. So went back a little too far again. Okay, so now that we saw that San Juan is now the new or more current referral hospital. Now, but you can see as we look back in time for January 1st, 2000, this health facility or this health center still, it refers to the previous value. And then if we click on the edit dialog, it will show us still that the different values for the periods of time. A couple things I want to show before I wrap up. Here we have the change request screen. So I am again logged in as an administrator, but if I were logged in also as, or alternatively as a registry maintainer, I can approve change requests that have been submitted by registry contributors. So here we see that this registry contributor user has made a number of suggestions for changing the data. Let me look at one right here. And it looks like that they updated some values and even changed some parent relationships. So I can view the details of the change. And here we see, looks like the name of location was changed. And there were some notes there and of why that was done. And you know, if this all looks good, then I can accept the change, accept all changes. And now the status is now accepted. So I have officially accepted the change. And one last piece to show you is we do have the ability to view data on a map. So basically we have what we call the Explorer, and it gives you the ability to drill down, navigate different hierarchies, and also you can specify a time component. So you can navigate, drill down, view for given dates. Again, that was sort of a really fast overview, but we are really looking forward to your feedback and would be more than happy to schedule a more in-depth demo. Thank you very much.
Thank you, Nate, for the demo. My name is Pedro Pagalday, and I'm the Technical Advisor in Health Information Systems for CHAI in Southeast Asia. I would like to take this opportunity to present to you our strategy and some of the results we had when it comes to CGR implementation in Southeast Asia. Due to the COVID-19 pandemic, I do not have as many results as we would like to have to present, since we had to adapt a little bit the timelines and the pandemic disrupted a little bit the work we were doing. But I'll guide you through the implementation strategy and some of the results and some of the challenges we are facing and how we are planning to overcome them. So I hope you find it useful. So first of all, I would like to quickly recap some of the current state challenges we're trying to solve with the CGR. In the GMS, most public health goals are linked to a geographical component. For example, if we take a look at different department goals such as EPI, malaria, maternal and child health, or health planning, we can see how all these goals share a geographical component to target interventions and measure progress. However, current state challenges might delay government in completing those goals. For example, we see in the GMS how most departments currently have its own list and are therefore basing its decisions on a different geography. We experience how linking geographies from different sources is very time consuming. For example, when it comes to prepare for a net distribution campaign, ensuring like your health facility list, village list used by the MOH can be linked to a population census to allow better targeting of resources and understanding the denominator you are targeting is usually very complicated and sometimes not possible to fully match those data sets. For example, it's very difficult to implement changes through time across multiple data sets. So the consistency we see in those is never accurate. We face challenges around knowing the right number of geographic objects to be expected to be found in a particular area. And this is especially problematic during a crisis, such as right now with the current pandemic we have going on. We also see how publishing accurate data, but in an inaccurate geography, it does create doubts about the validity of the information. And finally, creation and maintenance of several geographies results in duplication of efforts. For example, how often do we see multiple funding spent into the same data collection activity for a geo-object, such as a village list, right? So to tackle those challenges, we are working in the GMS in a 2-year grant funded by BMGF with a special focus on Lao PDR for a full implementation and Myanmar as an scoping country. The main strategic goals of the grant are around improving capacity of ministries of health for in-country data analysis and use, and increase data-driven approaches in public health. The project consists on several different phases or stages, which can be subgrouped in 3 main categories of the activity types we are trying to do in country. So most of the project consists on operational activities, with just the CGR software as an enabler to solve current state challenges. The first phase has been to do a situational assessment, which components I will explain in detail a little bit later on, but that situational assessment informs the whole implementation and strategy process. Outcomes of the situational assessment are used to define the governance structure needed to manage the whole CGR content, and also what's the content that is going to be included in the CGR. In parallel, the outputs and discovery from the initial 3 phases is used to keep building the functionality of the CGR software and define the essential integrations across different health information systems that you might need to actually achieve the full potential of a CGR implementation. And the last 2 phases are targeted to ensure sustainability of the project by building capacity of Minister of Health and relevant stakeholders, and ensure that the lessons learned in this geography can be applied between different countries. As a quick summary of the work today, as you can see, the work has not really started right now. It's been a process for several years. It all started with Health GeoLab with the support from the Asian Development Bank, releasing the HIS Geo-enabling framework. Afterwards, during 2018 and 2019, an MVP of the CGR was developed already under BMGF funding, and we did some user testing in Cambodia to understand whether the MVP was solving a real gap, and the positive outcomes of the user testing sessions allow us to continue with advocacy and scoping opportunities in Southeast Asia, which led to what we are today. like focusing more on an actual implementation. So since November 2019, we have been focused on developing new functionality to strengthen interoperability and improve user experiences. And we have ongoing work in the situational assessment, which is almost completed in both countries. We have ongoing work with in-country partners such as WHO in defining the CGR content and working on certain lists. And we have ongoing user testing also to validate requirements and ensure the software is fit for implementation. So let's talk about the situational assessment process, right? Which process we've been following and like why it's important. It is basically the main cornerstone for the whole implementation process. So the main goal of the situational assessment is to identify the right opportunities and strategies for CGR implementation. We focus on identifying opportunities on use of geospatial data and technologies within the Minister of Health, but also initiative outside the Minister of Health. For example, looking on whether there is an NSDI set up in country that could benefit from the CGR and provide the right enabling environment for coordination between ministries. And we do that by facilitating workshops, interviews, etc. So far, the situational assessment is almost finalized. COVID-19 really affected the ability to carry it out on time since priorities changed for the Minister of Health. So we had to adapt a little bit to the new normality, but we hope that by the end of the year, some of the results can be made publicly available. So let's talk about which outcomes are we expecting from the situational assessment. So the situational assessment provides the following key outcomes that will be used to inform the next stages. So the situational assessment provides the information we need to understand the health sector priorities, the strategy followed to address those priorities, and identify the different stakeholders that are tasked with implementing those objectives and are potential beneficiaries of the CGR. And also it helps us define and showcase the usefulness and benefits of the CGR, like doing that advocacy within the different programs. A very important part of this project is to identify and be able to adapt the implementation to current governance mechanisms and policies around the use of geospatial data and technologies and cross sectors. Another key aspect is to understand the availability, quality, and accessibility of the data that will define a better allocation of resources needed when it comes to creating the CGR content. So for example, if a country already has a really up-to-date and of good quality health facility master list, there is not something we should focus. But maybe if some partners, it's already working on creating a village master list is something we can collaborate. So also looking for those different collaboration mechanisms and make sure there is no overlapping of resources. In addition, for the CGR to have the biggest impact, it should be integrated with those information systems that are collecting programmatic data and make sure that all of them are using the same geography from the same source of truth, in this case, the CGR. Hence, we do analyze how those systems currently manage geographical information, how temporal and geographic dimensions are integrated in those systems in order to define the technical architecture needed for a CGR integration with those systems. And finally, we look at the technical capacity and support available within and outside the health sector to support the deployment of the CGR and sustain its management beyond the graph. So during stages 2 and 3 of this project, we aim to create an enabling environment and accurate CGR content to solve current state challenges identified during the situational assessment. So to recap, during phase 2, the aim is to set up a routine coordination mechanism where relevant stakeholders make key decisions on data management, such as define master lists, define the SOPs to update those master lists, regulate the data access, define best practices in data collection, management, etc. So once you have this setup, it can be done in different ways depending on the country. So ideally, the coordination mechanism could be an NSDI, but there are countries that still do not have an NSDI or they're not planning to have one in the short term. So then you can rethink the approach in those countries as using some of the technical working group meetings that are already happening, and that they gather those relevant stakeholders for this list and the CGR content. So you could reuse some of those technical working groups to discuss some of the matters of the CGR. So here the approach really depends from country to country. As in any implementation, it's important to start simple with those geo-objects and use cases that will allow you to show the highest impact to keep increasing the CGR content, right? So first of all, you want to make sure that you have MOH buy-in, you have some kind of sectoral buy-in, but yeah, you might not get first like 20 different departments collaborating, right? You might have to start with a smaller implementation, maybe focusing on a few core master lists, and like show the value of having that coordination mechanism. So in this period, we aim to focus on the most relevant geo-objects to be used by the Minister of Health to improve data usage, especially in communicable disease programs, such as malaria and immunizations, and then emergency and outbreak management and health planning. So for those, we are aiming to get together and have the most up-to-date health facility lists, health catchment areas, and community health worker list. Community health worker list is especially important in the GMS for the malaria use case, and we believe it's a list that will have like high programmatic impact in data use, and it's actually like being very demanded by the governments. Currently in most countries, there is a high number of community health workers in the field, but there are big challenges in knowing like where they are. And finally, and to prove the benefits of cross-sectoral collaboration, we are aiming to have full collaboration between Minister of Health and other ministries through the CGR for administrative divisions and a village list, essentially. Until here, as you can see, we have been mainly talking about operational aspects and not the technical platform. But this project, as we talked before, also has a component of implementation of an information system. So what have we been doing and what are we going to do for a successful implementation of the CGR, of that software component? So first of all, we need to make sure that the software is fit for purpose and adapted to country context, right? So we use the outputs of the assessment, we use feedback we get from user testing, and we get information that we got from the current state challenges and previous experience when delivering interventions, etc., to inform current requirements and define the CGR functionality. So the most important piece, as I talked before, starting from 2018, it was user feedback, right? As is any software validation. So the initial user testing in 2018 really helped validate the software roadmap. And during the next few months, we are doing additional validation of the newest functionality and identifying those requirements that add the highest value to the goal. This is usually challenging, right? Because in tech projects, as you know, scope creep is usually hard to manage. So these sessions really help you like put things into perspective to make sure that what you are building is actually what the client needs, in this case, the government. And finally, we are looking for integration with DHIS2 as the main priority system for integration within the CGR. This is because DHIS2 is widely used by the Ministers of Health in the GMS for their HMIS systems, vaccinations, malaria, health statistics, etc. So this CGR connection with DHIS2 will be key to ensure the Minister of Health can use the most up-to-date list for the programmatic work and intervention delivery and planning. Also, they can integrate information from different programs, since it's a challenge they're having right now. Sometimes even between different DHIS2 instances, they're using different geography because they use a different reporting hierarchy, etc. So then it becomes difficult for the MOH to aggregate data from all those different systems. So we hope that the usage of the CGR and the CGR syncing data with DHIS2 will really facilitate those programs and really have a positive outcome in data usage. We are also looking at other systems that could highly benefit from being integrated within the CGR. For example, one example could be your logistic management systems, right? And also other cross-sectoral platforms where whether Minister of Interior or Minister of Planning would like to connect and benefit from those. The last piece of the implementation phases is to ensure that all these activities are sustainable. To do so, and knowing the challenges and lessons learned we face when implementing other information systems, we aim to build capacity to relevant stakeholders within the MOH and other departments as we can to ensure they can manage their own master list. We increase their GIS capacity. We ensure they can maintain the software platform, and we also provide them meantime the necessary technical support to solve implementation challenges, bug solvings, etc. So to finalize this session, I wanted to quickly talk about the challenges we have been facing so far. And I want to clarify, like, even though we present them as challenges, like also these challenges, they usually also come with an opportunity for you to do more things. So, I mean, the main challenges that everybody is facing right now, it's been the COVID-19 pandemic, right? It's really affected the ability to conduct the situational assessment faster, since priorities within the country change. The lockdowns in country have required adaptation in not being able to have meetings, interviews, or group consultations, etc. But also the pandemic has also helped in increase the interest of the MOH in having the CGR set up and implemented. Citizens realize they need some of those datasets, they need some of that department collaboration to be able to target their COVID responses better. So that in a way has really accelerated the work in certain pieces when it comes to content of the CGR and getting those lists ready and available. Again, I think there is no mystery when we talk like coordination between certain ministries, it can be difficult, you know, especially due to political issues. Sometimes they just don't talk to each other or the way they are used to work, right? But we've also seen that there are opportunities, especially under the SDGs umbrellas, where ministers are aiming to work with each other. So new opportunities are coming every day, so we just need to stay alert to see how we can leverage those opportunities in the future. Also, one of the main challenges, and it's been more related to implementation, it's been to differentiate the messaging around the operational activities and the need of a technical platform. For example, when we were talking at the beginning, we see how the CGR focuses in everybody using the same geography, etc. But for that, you don't really need a technical platform at the beginning, right? But the technical platform is just your enable that helps you manage those things in a better way, right? But sometimes when you bring the component of the technical platform, it creates automatically a pushback reaction towards a project in certain settings. Sometimes because they think they're not ready, because they think you want to substitute all the systems that they have. So focusing the messaging, especially in understanding why the CGR concept and its content is so important, and that the platform is not here to substitute any system such as DSGS2, etc., that they've been working on them for so long, that has really helped to increase acceptance in the GMS between governments, to see them more as something that is going to facilitate their work rather than something that is substituting their current systems. Finally, as in any tech implementation, I think like managing a scope creep is a continuous challenge, especially when you have limited resources for development and implementation. So basically, the way we're trying to solve it here is understanding what actually provides the highest value in the field. So bringing the product to the users as soon as possible, it really helps putting in front of them, doing testing, and then even just piloting, even though if you don't have all the functionality that they think they want, just pilot it, because you always realize that you can keep building additional and additional things because user will keep asking for more, but then they're not really used in the field. So it's like, is this actually needed to provide those functionality, or we can focus in something else? And finally, as I think in any project, and especially those that have a tech component, but here is not only the tech component, especially a project like the CGR, where it aims to change so many of the current practices, change management is a challenge, and it's becoming like extremely important for people to see that as a positive change. So finally, I want to talk about the upcoming work that we are going to be doing during the next year. So during the next year, our focus is going to be mainly focused on the implementation. So after situational assessments, etc., have been completed and we have a strategy, it's going to be on finalizing the CGR content within country partners, set up the enabling environment, and finalize user testing by the end of this year. And then be able to start with a phase implementation of the CGR, probably starting with 1 or 2 official lists to manage within the system, show value to different departments based on the results that you're having on that, obtaining positive feedback and advocacy within the different ministries, and then of course keep continuing expanding that implementation as much as possible during the rest of 2021. And of course, like, yeah, keep building capacity, making sure that after the grant is done, the system can be maintained with the government and ensuring they have all those mechanisms in place. So thank you so much for everybody for attending the presentation. I hope you enjoy it and let us know your comments and questions.